It is now 4:30 Central Standard Time. I'm on time, on budget, Ron, and I'd like to open it up for a few questions, and then I will conclude.
Well, we have some. Bravo, Dr. Baum, for bringing the topic of branding down to earth to a very practical level. I hope everyone feels the way I do, which is there's so much of this marketing mumbo jumbo these days, and this really makes it very tangible. And that really leads to the first question. The question is, I see that you've gotten as many as 11 patients from one branding maneuver. If I brand and do these things that you're asking me to do, how many new patients a day might I expect?
Well, it depends exactly on what you're trying to brand. If you're trying to brand a weight loss program, you could get your cup could run us over because the number of people that are interested in losing weight, at least in Louisiana, are there's multiple opportunities. In my practice, I get 4 to 5, sometimes more, but average 4 to 5 new patients a day. Every single day I'm in the office that come as a result of branding. So you can, now it isn't going to happen overnight. It's not going to happen in the next week. This is a process. This takes several months to work, but if you keep at it and you follow the guidelines that I gave you, and I will also make available my article on branding to you, you can expect to get multiple patients every day as a result of branding.
Very good. So much depends on the type of specialty, the size of the practice, what you're branding, etc. Makes total sense.
So here's one from Kelly Rufus. How do I get my practice on page 1 of Google? That is the hottest topic I think going, is to get on the on the top of the Google, to get on the first page. And this comes, I'm going to allude to this in my article that I'd be happy to send out. It's also, I'm going to show you a copy of my book that is available on getting to the top of Google. But essentially, it is this constantly keep putting information and content onto your website, your blog site, YouTube, Facebook, and Twitter. You don't have to do all that in the beginning. You start with your website and a blog. If you go into WordPress.com, type in my name, you will see about 1,000 blogs. And I blog on everything from urologic topics to general health to today I just wrote a blog on treating sunburn with oatmeal. But you have to have clever titles. What's going on down there? That's the title of my book, is a title that is very effective for urinary incontinence. If you put urinary incontinence diagnosis and treatment, you're not going to get much traction. If you put leaking urine, what's going on down there, you are likely to get hundreds or perhaps thousands of responses. I also do a YouTube. I have 100 YouTube videos on YouTube, and I strongly recommend that you go to YouTube and look at samples of them. So it's consistency of updating and providing content to your social media. You can do it yourself. It is possible. Most doctors are not going to find the time to do it, and I think Vanguard can be so very helpful in doing this for you. It is not expensive, and if you think if you can get on the first page of Google where you must be, and if you get 4 to 5 new patients a day, I can tell you 1 or 2 new patients will more than pay for your Vanguard to help you get on the first page of Google.
That actually is a good segue to the next question from another practice administrator who says, I have doctors who do not like to spend money on intangibles such as marketing. It would be a very hard sell for me to try to get someone to help us from the outside? Do I need an outside marketing consultant to help me brand?
No, you do. No, you do not. Oftentimes, a younger physician just starting has the time to create a blog, to do a YouTube, and if you'll look at what I've done, I haven't paid anything. I do it. I have people in my office do it. I have my associate do it. I do some of it, but we don't pay for it, and so the doctor has to decide if he is interested in getting and attracting these kind of patients and building his brand, will he commit the time and energy to do it? If on the other hand, he's maxed out, too busy, but wants to see about sculpting and getting the type of patients he wants to have in his practice and doesn't want to spend the money, hey, I respect that. He can do it. He or she can do it, but you're going to have to delegate some of that to your existing staff, or the doctor will do it himself. But you do not necessarily need to go to an outside uh, uh, resource or service to help create the brand. It's just time. In other words, I'm throwing out. Let's just say it's $500 a month. What would you have to do? How hard would you have to work to make $500? It probably, isn't a full hour, and you can easily, if you see the results. Now, one of the things that you're going to want to do is you're going to want to make sure that you're getting a return on your investment. In my practice, we get more than a return on the investment that we put into it.
I have another question, and this is one from actually an orthopedic practice that says, how is it possible not to charge patients when they've been waiting? And I think the implication here is that you have insurance complications and other things.
Right. Okay.
If you don't charge.
I'm glad I got a chance to answer that. If you're late and the patient's really upset, I say to the patient, I mean, you can tell. You can see their jugular veins dancing over their shirt, and they're leaning forward. Their face is red. Their blood pressure is up. They're visibly angry. I walk in and I say, I am so sorry, I am late. I give a reason. The previous patient had a situation that required me to spend additional time there. Because I am late, I'm not going to charge you. Now, you can get away with that by not charging the insurance company and waiving the copay. That is illegal. But to say I'm going to see you for free is not illegal. The Office of the Inspector General is not going to come knocking at your door because you gave pro bono care away. What you cannot do is waive the copay. Now, let's just say the office visit was $100. Isn't my reputation, which I spend my whole life protecting and polishing, worth more than that $100 that I would have collected from an angry patient who will go out and denigrate me to the public? It is far better for me to say there be no charge. I've gone out to the public, introduced myself. I said, hi, my name's Neil Baum. And somebody will say to me, oh, wait a minute. I heard about you. You're the doctor that didn't charge a patient that was made to wait. Now, wasn't that worth more than $100? I can tell you it is. But remember, don't waive the copay. That's illegal.
I've got a question here. Pretty interesting. I think this is a common problem in many places. It says, I run a urology practice with 26 physicians in Pennsylvania. I very much appreciate your comments on staying on schedule and your wonderful tips. However, how do I get my doctors to change their mindset about punctuality? I think the implication here is the staff can do a lot, but if the doctors aren't on board, then it undermines it.
It's got to be that office manager. You've got to notify the doctor. It's trickle down. If the doctor is not on time, the staff's not going to be on time. If the doctor's not on time, the patients won't come on time. If the doctor is routinely 45 to 60 minutes late, the patients will dribble in as they deem appropriate for them. You'll be uh, go over the end of the day. You'll have to pay overhead. The doctor has to come a few minutes early. The doctor should give, like I do, I give a pep talk before we start the day, telling everybody, about what we're going to accomplish today, what are some of the issues that we have to cover. Make sure we have all of the reports and blood work on the chart or in the electronic record before we start the day. I arrive 5 or 10 minutes early. I do not go to look at my computer in the stock returns or read the newspaper or return phone calls. I do not accept pharmaceutical reps to come into the office while I am seeing patients. What message do you send to your patients when the pharmaceutical rep walks in, the patient's waiting a half hour, the pharmaceutical rep walks in, goes to the front of the line? That's saying to the patients, the paying patients, that the pharmaceutical rep is more important than I am. They know what's going on. Pharmaceutical reps schedule appointments with the practice. It doesn't have to be a lunchtime, but they schedule appointments with the practice. We see them on time, but we do not allow them to cut in while we are seeing patients. We treat being on time as something sacred in the practice. The doctors have to be there on time, and you can reward the doctors. They can be tiny rewards and tiny penalties, but you have to ask the doctor, do they want to have an on-time practice where they get good patient surveys, positive patient surveys, because they're going to get compensated in the future by the results of the patient satisfaction scores. And you aren't going to get a good patient satisfaction score if they're waiting 90, 120 minutes in the practice, waiting for to be seen by the doctor. So good scheduling is vital to having good patient satisfaction scores, and it starts at the top. You can't ask the staff to be on time if the doctor's not on time. You can't ask, and if the patient is late and the patient is late and it's a situation where they're not elderly or they're depending on someone to bring them in. Listen, we're flexible and we are understanding. But if it's a patient who could be there, and should have been on time, is chronically late, we say to them, you will be seen at the end of the line. We were expecting you at 2 o'clock, it's 2:45. If you want to reschedule, fine. And then that patient is always rescheduled as the last patient of the day. So we train the patients to be on time, just as myself and my associates are, I use the word trained, but we are conscientious about being on time for our patients. So to that 26-member group, the chief managing partner has to commit to patients, to the doctors being on time. And then it will trickle down all the way down to the patients and the staff.
It's a cultural change. It's a commitment to a certain culture.
You actually have to have a change in attitude about the importance of being on time. The other thing that I would recommend that practice do, and all other practice, is do patient surveys. And survey patients, what bothers you most about this practice? What can we do to improve? And you will see the answer saying, we want to have access to getting an appointment. We don't, if a patient calls and says, I have stinging and burning when I urinate, and they're told that they have to wait 2 weeks, they're going elsewhere, urgent care, and never come back. And so we have created that same-day appointment concept so we can get the urgencies and emergencies in. Listen, if a patient calls and says they're having erectile dysfunction, we don't call that an emergency unless he has one that lasts 4 hours, like on TV. We don't call that an emergency, and they get a appointment in the future. But if someone has scrotal pain or kidney stone or burning on urination or blood in the urine, they're told to come in and we create a same-day appointment for them. But yes, it has to be an attitude change all the way at the top.
But our next question actually comes from a doctor and a good friend and client of Vanguard, Dr. Rink Murray in Chattanooga, Tennessee, who, by the way, is going to be our next webinar presenter, and I want to talk about that in just a moment. But he asked, you have some very good suggestions for search engine optimization and Google rankings, blogging, etc. How do I find the time to do some of this myself? Do you have any tips from your experience on setting aside time from clinical duties?
Yeah, this is something I do between cases. He's a urologist, did you say? Dr. Murray is a urologist?
Actually, he is the son of a urologist. He is a reproductive endocrinologist, fertility doctor.
I often will do this, during downtime, like between cases. I often will do it sometimes early in the morning. I often delegate some time on the weekends to it. I find content everywhere. I go to Google search, and I have one of the things about getting on the first page of Google is you have to effectively use keywords. But maybe we could give another webinar another time on getting to the top of Google. But it's also there. If you type in my name and getting to the top of Google, you'll get my article on how to do it, because you have to use keywords and you have to find content. Content for me is everywhere. The other day I walked into the surgical lounge, and I saw a article in a pharmacy throwaway about splitting pills and the danger of splitting certain pills, like antihypertensive pills and heart pills and antibiotics. These are dangerous pills to split. And so I found that article and I blogged on it. Now, no patient is calling my practice to say, I want to see Dr. Baum because I read his article about pill splitting. But people are going back to my website over and over, and my blog site over and over again, because I'm providing credible content. Your practice is special, and you are special, and you are unique. Now go out and scream it from the rooftop, but particularly from the internet site and the social media, to let people know how special you are, what makes you unique and special. So don't just say it. Last slide. My real final message to you. Don't just say it, because that's hollow. That won't get you any point. You've got to go out and, as Nike says, just do it. For those of you who are interested in a copy of the slides or a copy of my paper on branding, if you write to me, there is my email address on slide 75, and you just write in at the top, Ideal Medical Practice of Branding. That will be sent to you shortly. I also would like to give a shout out for my book. This is just published in January of this year. It's a complete business guide for a successful medical practice. It's about how doctors need to be involved in the business of medicine. No longer is it a sin to talk about patients as customers, and we have to treat them as something special, and we have to give outstanding service, and we have to get involved in the business of medicine. Well, Ron and Taylor and all of you out there listening, including Dr. Murray, and also the office manager, Kaylee Buntis. I thank you all for taking the time to listen. I hope you found good, useful information. I'm eager to hear from you. This is Neil Baum signing off from Cajun country, where it's 95 degrees and 95% humidity.
I thank you very much, Dr. Baum. I want to underscore the value of Dr. Baum's book with his co-authors that you see on the screen now. it is the most comprehensive book. It's a very thick book full of information on everything from employee compensation to negotiating with insurance companies to marketing, of course. It's very well worth the cost. I also want to note that we will have our next webinar September 17th with Dr. Rink Murray from Tennessee Reproductive Medicine of Chattanooga, Tennessee. And the topic will be social media for physicians and why you should do it. So we'll be sending out an email on that very soon. In addition, today's webinar has been recorded and will be posted to our website. I'll make it available to also Dr. Baum's website as well. He's very generous in sharing his email with you. I encourage you to contact him. He's one of the most helpful, friendly, supportive people you could ever meet. And in the meantime, please keep your eyes and ears tuned our way for our newsletter and other information about future webinars, including the one on September 17th with Dr. Murray.